The condition of the foot is so important that even with the presence of huge broad muscles, you can perform a pull, lifting 50 kilograms, and pull up 15 or even 16 times. Someone even 17 times. You can pull up a huge number of times, but if your foot is problematic, if you have problems with your foot arch, be it crosswise or lengthwise, or both crosswise and lengthwise, then even your incredibly strong muscles lose tone when you stand on weak, unstable feet. The foot must be stabilized by certain muscles. All bones must be in a strictly defined place on the foot. There are many of them. We will sort them out. And if there is a shift, even one, it already causes a reaction throughout the body. This causes a disturbance that is reflected throughout the rest of the body. If the scaphoid bone is dislocated, your shoulder will drop, the broadest muscle will not work. You may have a shoulder pain on one side or both sides. The most interesting thing is that your shoulder can actually hurt. And below this, you may not even feel it. You will only pay attention to the shoulder. That's why it's important to find a correlation between such phenomena. Why shouldn't this seem unbelievable? Because, for example, if you build a house on some curved surface, don't be surprised if it falls down sooner or later. If you're standing on curved feet, don't be surprised if something ails you sooner or later. In essence, this is one of the most important disorders that should be corrected in treatment. If the foot problem persists, everything you've trained for will eventually revert because we're constantly relying on it. If this support is asymmetrical, incorrect, everything above starts to crumble. The foot, as you see, consists of many small bones arranged in several rows. The largest bones in the foot are the heel bone, and the talus, which is located above the heel bone, they form the ankle joint. It is formed by the calcaneus, talus, and navicular bones. The position of these two bones is very important. It often happens that these two bones change their position. The metatarsal bone is constructed in such a way that during a step, when a person flexes the foot, it comes into contact with the surface at a certain angle. For this, there must be a strong enough flexion of the foot. As you can see, the angle between the foot and the shin is less than 90 degrees, practically 45 degrees. This is the angle between the foot and the metatarsal bone. The foot should flex in such a way with each step that the pressure on the metatarsal bone comes at the correct angle. If the flexion is incomplete, then the metatarsal bone comes into contact with the surface at an incorrect angle. If they do not form approximately one axis, then the pressure is not evenly distributed between the metatarsal and the big toe bones. As a result, the metatarsal bone acts at a small angle and shifts back, changing its position. What does this lead to? This leads to the stretching of the plantar aponeurosis, in which the plantar fascia is located. It should be stretched to a certain level. But when the position of the heel bone changes, when it goes back, there is a stretching of the plantar aponeurosis and irritation at the place of its attachment. Here, in the area of the heel bone, a periosteal injury occurs. Because of this, microtears occur at the attachment site of the plantar aponeurosis itself, leading to damage to the periosteum. Here, an inflammatory process occurs, and in the future, ossification may even occur. In other words, salt deposits. Thus, a heel spur is formed. It can then be treated with miraculous ointments. Various balms can be applied. It can be steamed in a bath, talked over, or bioresonance. Shockwave therapy can be used. But if you're going to walk dragging your foot, and if you don't have a full flexion of the foot, you can do whatever you want, but you'll always have this plantar fasciitis pulling. That is, you need to use your feet correctly for walking. You don't drive a car on 3 wheels and walk correctly as the foot is reliably constructed, and you won't have problems from this. The fifth bone tends to go back during a step. And all this happens because of the incorrect use of the foot. You do not fully flex it. Or you move your foot at the wrong angle. As a result, the foot does not move straight forward, but slightly to the side. In this case, the load is distributed incorrectly. The metatarsal bone does not get a full flexion during movement, and it will not be there when the foot moves to the side. So don't be surprised if you notice that your shoes are wearing out unevenly. Think for yourself what happens to your joints if the shoes wear out unevenly. This should alert you. If you notice that the rubber on the tires is wearing out unevenly, this should alert you. Why aren't you alarmed that the shoelace in the boot is wearing out unevenly? This should alert you. That is the metatarsal bone and the flexion of the foot. You need to pay attention to this. The next one is the tarsal bone. Here, the tarsal bone tends to shift forward. The forward displacement of the tarsal bone occurs because the 2 bones, the big toe and the little toe, are connected together at the bottom. And they are held back by the rear tibialis muscle, located between these muscles. Everyone wants to know the exercise for it. This muscle underpins the interosseous membrane, which is located here. Another function of it is to hold the fibula together with the tibia, not allowing it to shift. If this muscle weakens, the bones begin to diverge. That is, they just diverge to the sides. And the tarsal bone, not being held properly, protrudes forward, which is bad. Firstly, the ankle joint suffers, and secondly, the muscle that flexes the big toe weakens. This is the extensor of the big toe. It would seem this is a very small muscle, but if the muscle that extends the big toe weakens, what kind of movement is this? But it turns out the weakness of this small muscle already causes a shortening of the forward step by 10 centimeters. And further ascending problems arise. If the step becomes short, all the muscles involved in this movement, those that work with the toe flexor and the big toe flexor, lose their tone to some extent. And from this one small muscle, problems can arise first in the knee, then in the ankle joints, and maybe even in the shoulder. All this happens because of the asymmetrical movement with each step. Another downside is that if you have a displacement of the tibia, for example, on the right leg, and you gather a group of such people with each step forward, the step with the right foot will be shorter than the step with the left by about 10 centimeters. Imagine if we all blindfolded ourselves and let them loose in the forest. Would they be able to find their way out? We don't even have to blindfold ourselves. It's not mandatory. They'll just be taken away and they won't find their way back. They will be walking in circles all the time. In the end, they will get lost because the length of their stride is different. Another downside is the displacement of the tibial bone. Thus, the dissection of the entire foot began, starting with these two bones. Why is the condition of the foot so important? Why is it important to maintain the longitudinal arch? Why is it important to maintain the transverse arch? If anyone hasn't heard, there's flat foot, when a full-fledged longitudinal arch of the foot is absent. There is also a transverse arch of the foot, which is located here, transverse flat foot. We will also separately discuss how the longitudinal and transverse arches are formed, which muscles support them, and why the condition of the feet is so important. It's important that the foot is in the correct position, even if it doesn't hurt. And why are the heel and toe bones important? Because they are your support. These are your two legs, and this greatly affects the position of your foot. How the center of gravity is distributed across the foot. You can work on strengthening your gluteal muscles, spine flexors, and broadest muscles, but it won't help if your foot isn't functioning properly. Every time you stand or walk and, let's say, your foot arch is not supported properly, all your broadest, rhomboid, and gluteal muscles lose their activity immediately. They all react to how the weight is distributed on the foot and how the foot participates in the step. If you remember the video about the cables, we talked about why the flexors become weak. The weakness of the extensor muscles on the heel arises because the center of gravity shifts forward. The same thing can happen without a heel when there is a muscle imbalance. If the muscles that hold the foot are so weak that the bones do not hold together, then flat foot occurs, in which the foot collapses, and everything that is above does not function fully, regardless of the volume of even the most developed wide muscles. If you have problems with your foot, then the standing foot will not work. It will only function in a lying or sitting position. Therefore, in the following videos, we will continue. We will figure out other problems that may arise. Let's talk about the arch of the foot, the cuneiform bone, the cuboid bone, what this leads to, where it comes from, what the reasons might be, and we'll get to the muscles that hold the arch of the foot itself, as well as to the large gluteal muscle, which everyone is waiting for some reason.